All right, let's get everyone in here. Send some requests. All right, guys. Welcome to our Thursday Lives, where we are going to bring in experts to talk about different topics. Today we have Megan joining us. She's going to talk about how your exercise routine can actually be messing with your hormones. And it's super interesting. Good topic. We're going to talk about a lot of things. Y'all can bear with me. I'm going to get everyone in here. They have to actually join the live first. Hey, Susie. It's just me right now. But I see you. Let's see if I can get. All right. Accept. Megan's joining us, and then. Oh, hi. Okay.
It worked.
It worked. Yeah. Okay. So this is the first time that I'm using like the like three different people, or all of us are in different locations. So I'm hopefully once my mom gets on, she'll figure it out. But I had sent her a request to join, so hopefully she comes in.
Yeah, I feel like there's a big lag time with like waiting for everyone to get in my experience anyways.
Yes. Oh, she just joined on, so that's good. Okay,
Awesome.
cool. Well, it's nice to see your face. We've only audio messaged. So.
Oh, it's nice to see your face too and like virtually meet.
Yeah.
Yeah, how are you?
Thank you. Good. Thank you for taking the time to do this. We really appreciate it.
Yeah, of course. Are you kidding me? Thanks for inviting me. And I love talking about all of this stuff, so I don't mind.
Good. All right, I'm gonna send her another request and see if that, yeah, here we go. She's like, I'm not getting the invite. I'm like, yeah, I know. I think you have to actually be in the room before you send the.
Joined the live and then I requested to join because when I clicked your request, it just took me to the live anyways. So if she's got,
Okay.
says hi.
I was like, request to join.
That's funny. Yeah, sometimes Instagram is its own beast. So just like Facebook too, like there's always glitches and someone's will work one way while yours works another way.
Yeah, I feel like it's been glitching a lot more recently. I don't know if that's just me, but I'm like Instagram's really effing up.
All this is frustrating.
Yeah. Well, while we figure that out, let's I want to do like an introduction for you and let you be able to kind of tell what you do and what you're passionate about and what led you down the path that you're on and get a feel for your business and what you're all about.
Sure. Cool. Well, do you want me to introduce myself? Yeah.
Go ahead. Yeah.
Well, and I actually did invite from my Facebook group. There she is.
Oh,
Yay!
there she is.
Yeah, I was tried to do it on my computer, but it wasn't giving me the request to join. So it's okay.
No.
Now we're on my phone.
I've never watched live on the computer before, but that would be more helpful.
A little bit. Okay. Hey, hi, Megan. Nice to meet you.
It was nice to meet you. So for those of you who don't know, my name is Megan. You can follow me at meganjoy_wellness. I think there's an underscore under there. I can't even remember. It's been a day. So we're going to be talking about hormones today, and I'm entering my luteal phase, which if y'all don't know, that's when you're tripping over your words and sometimes you don't make sense, and that's totally normal. So if I say something that doesn't make sense, welcome to my luteal phase. So I am a functional diagnostic nutrition practitioner and a board certified holistic health practitioner, certified personal trainer. All that fancy stuff just means that I have been on this really long personal journey of a lot of health struggles that I was just gung-ho about getting the answers as to what I was experiencing. So at the spry age of 18 years old, I was diagnosed with irritable bowel syndrome. And, my doctors had no answers, no solutions other than a pill or the low FODMAP diet and this and that. So I never got answers. I kind of took my health into my own hands at that point. I felt like no matter what I ate, no matter what I did, I was always bloated. I've tried everything you could possibly think of, including like fasting for 20 hours a day, because everything that you eat really affects you when you're struggling with that. And long story short, because the underlying root cause never went addressed, my issues manifested. I had a lot of hormone issues, period issues. I was misdiagnosed with endometriosis. I had a miscarriage. It led to like a big ordeal in my health, which it didn't help because I was also a fitness competitor and really drove my body into the ground. So I love talking about fitness, but now definitely from a more sustainable standpoint after that whole experience. But I really drove my body into the ground and had the start of autoimmunity and a lot of things going on. And what led me into functional wellness was finding my own practitioner, just saying enough is enough. I went to my doctor so many times, showing up with psoriasis all over my body after a miscarriage. I could barely peel myself out of bed, debilitating period pain, heavy bleeding, a lot of issues. And I had no answers yet again. So I said, enough is enough. I started searching naturopathic and functional wellness. I was like, what the heck is this? I worked in, conventional mainstream medicine for 10 years. I was like, I know it exists, but I don't know anything about it, but I know I want to know why this is happening. And then I found out. I found a practitioner. I found someone who was doing what I went to school for and what I do now. And she actually heard me. And, I started running tests and getting to the root cause. And I was like, whoa, if I'm a good advocate for myself, because that was my job, being the doctor's eyes and ears for so long in the hospitals. If I can advocate well for myself and not get the answers that I need, what are other women experiencing? Mm-hmm. And so it just evolved from there. I created my program, She Code, and have just been learning and growing and evolving and impacting women's lives since then.
That's great.
That's awesome. It's a story we hear over and over and over again. Sometimes not the part where you get to figure it out, but that part where you're stuck in this. It's like intuitively, I know something's wrong and you guys aren't giving me any answers and I really don't know where to go to find them, but I know that there's an answer. It's like, and it's this loop. And I think as women, we're just constantly not listened to. And I think sometimes that's the biggest piece in the beginning of the journey is finding that person that sits and will listen to the things that, and take them as a, something real that's really happening to you physiologically, not just up here, which is what we're told a lot of times. So,
yeah, I totally agree. And I talk about like medical gaslighting a lot just because I've seen it professionally. I've experienced it personally, and it's a real thing. It's something that I'm often talking on consultation calls with women about, like, hey, I went to all these doctors. Hey, I did all of this and I got testing done, but I'm still not being guided as to what I actually need to do. I'm being given like blanket solutions that you're not listening to me. You're not helping me. You're not guiding me through this journey. And so, I mean, what you both do and the work that we're all doing here together is definitely something that's needed in the community of women for sure.
Agreed. So, yeah. Well, thanks for sharing your story. It's great. You're in a place now where, you can look back on that and then take everything you've learned and move forward and also help others. So that's pretty awesome. So now that I'm on my phone, I lost my list. So Kate's going to have to guide us through all the things we're going to cover today.
That's okay.
Well, so one of the things, besides the name of your program, which was the thing that first like drew me to looking into you more, because obviously like our whole company is She Health, and then we saw the She Code and we were like, what is that all about? And so it's just funny that you know, that simpatico, I guess.
Yeah,
Similar brain. But I was super interested in your journey with exercise specifically, just coming from the standpoint of like the fact that you did, like you were competing, and what that did and how that played a role in your hormones. And the reason for that is we right now our practice is focusing a lot with postpartum women, and postpartum meaning like anywhere from I just had a baby to it could be often years after.
I was gonna say my baby's 10 and I'm still dealing with stuff.
Right. Just because I never got the answers, right? And or I did the wrong things that are compounded over years. And one of the things I think a lot of women do after having a baby, because our culture is horrible in this bounce back sort of stuff, and we go right back to it, and we want to lose the baby weight, and we want to do all this stuff, and we go. And I think exercise is playing this huge role in, like I said, like compounding some of these hormonal imbalances. And I was like, I bet Megan would be able to speak to this really well, which is why I'm really happy you're here with us. And this is, I mean, not even just specifically for postpartum women, it's all women. I just know our client base right now, that's the stage of life that they're in. So so I wanted to kind of dive deeper into that experience and what you really found personally with like your exercise and hormones and how that affected you.
Yeah, absolutely. I love talking about this because, you know, for me personally, you know, fitness was a huge pivotal thing in my journey. You know, I was kind of I don't have babies. I had a miscarriage, and hopefully I'm a mom someday soon. We are trying for the world to know. I guess I don't know. I'm an open book. But I kind of had a similar life experience where I had a clinical identity crisis. And often that's what happens with women when they go through a big change of life, or they feel like they're, you know, just worried about responsibilities. Outside of that, it's like, who am I? I know a lot of women, postpartum included, up to 10 plus years afterwards, it's like, who am I outside of taking care of everyone else and everything else besides myself? And oftentimes it starts with a health journey. And for me, that was my case. I mean, I was already kind of on this health journey, up and down and yo-yo and trying this. But I committed to competing while my husband was deployed. And that was really pivotal for me. It was really great the whole first year. But what I didn't realize is that when he came home, what was life going to be like? Because it was just me, myself, and I, and the dogs. And I got to focus on just that. And it was great. But when he had come home, and for those of you who don't know, competing is very, very extreme. I don't think that I would ever do it again. Just because it's upwards of 6 days a week of hardcore training, you know, lifting an hour to 2 hours a day, plus cardio, plus caloric restriction. And it's a very, like you said, like this culture that we live in and the way that we look at our bodies and the way that we almost position like our self-worth is like how we look in our clothes in a bathing suit and all of those things. And competing exacerbates all of that. So long story short, although competing is extreme, it replicates a lot of what women are going through. They're kind of jumping in this all or nothing bandwagon where, hey, I'm postpartum and I want my body back, or, you know, I'm not feeling myself. I want to take care of myself. So I'm going to go gung-ho in the gym. I'm going to go gung-ho on my diet. I'm going all or nothing. I got this. And what happens then is we're all in, then we're all out, then we're all in, and then we're all out. And we have this metabolic adaptation where it's just, yeah, I mean, talking into hormones, it's like we've got your cortisol, we've got your progesterone, we've got your estrogen, your insulin, you can become more insulin resistance, then we see PCOS, then we see infertility, then we see tons and tons. Thyroid issues are huge for women. You know, I could go down the rabbit hole and talk about each one. I don't know if you have questions.
I think, yeah, no, I know. And they're all rabbit holes because so much of the information that like we all know isn't available to people. And you could just sit and educate all day long and talk about these things and all the pieces that that aren't put together in a conventional way, that what people would really understand, or what they've been already taught or already told. But I think specifically when Kate and I were talking is, about like the things we wanted to learn from you. And I loved your post on the thyroid the other day too, by the way. But the, is the hormonal connection, and maybe specifically talking about the metabolic piece of that, because I think that when people think metabolism, they go right away to thyroid, right? Like that's the mainstream connection. Something must be wrong with my thyroid because I can't lose weight and my metabolism is slow and this is happening. And it's more about that up and down training of our body not knowing when it's safe, when it's healthy, when it's doing whatever. What did you call it, Kate? Metabolic flexibility.
Metabolic, I mean, either way, like the broken metabolism. But yeah.
Right. And I think that that's something that no one's really recognizing or talking about right now. And the effect that has, yes, on your metabolism, but also on the hormones that are just like, have no idea. What am I doing anymore? I don't even know what to do. I don't know what to make. I don't know what to do. I don't know how to convert that or make this or have this in reserve. Like, we've trained our bodies out of what it's naturally able to do.
Totally. Yeah. And I think a great way to kind of like summarize that, instead of like going down the rabbit hole with each one, it's looking at like exercise, because we want to incorporate this with exercise, right? It's like, what is almost the minimal effective dose? Are you going gung-ho and are you over exercising? Because there's this kind of like sweet spot of 30 minutes where past 30 minutes, exercise actually becomes a distress on your body instead of a eustress, meaning it becomes a bad stressor instead of a good stressor. In order to change your body physically and your body composition, you do have to push yourself. You do have to stress the body, break the muscle down, allow yourself to relax and repair and recover to build your strength back up, repair your muscle tissues bigger than what they were before so that you could be stronger the next time you work out. But what happens is we go gung-ho. We think we have to be in the gym all the time, which there's so much research that is proving it doesn't matter if you work out 3 days a week versus 5 days a week. You're almost getting the same results over a 90-day period because it's about consistency. It's about how well your body is recovering. And if you're a woman who's experiencing symptoms, your body is already stressed out. So if you're adding more stress on top of that, and it's kind of just this domino effect that is spiraling you. Basically what I always say is like, your needle is moving this direction and we want it to go this direction because you keep piling on stress, stress, physical, mental, emotional, all of that stuff. But everybody knows like cortisol is our main stress hormone. You have 50 hormones in your body. Cortisol is not the only one. Estrogen is not the only one. Progesterone is not the only one. So if you're in this chronic stress response that we're not designed to be in, especially as women, we're a lot more sensitive to that stress. That then affects, yes, your thyroid, yes, your ovaries, your brain, your gut, your liver. It slows everything down because, and you kind of said this, it's like your body doesn't feel safe. And when you combine it as well, like with dieting too, because often extreme exercise comes, a lot of dieting, your body is going into like starvation mode essentially, and it's holding on to toxins, it's holding on to inflammation, it's holding on to body fat, and we think that I have to eat less and do more and I'm going to get the results that I want, when actually it's like training women to eat more and do less oftentimes.
Right. Yeah. And that was kind of, it's funny because we wanted to cover like a myth. And I think that that's one of the biggest things that women believe is that, okay, I'm just not doing enough. I need to be better at, I have to exercise more intensity, go do a HIIT class, do all, and then calorie restriction. I mean, a lot of people still have this mentality about if I eat less and I exercise more, I'm going to lose weight. When really, like you're saying, your body goes into starvation mode, your body feels unsafe, your cortisol levels go up and messes with your insulin, everything, right? And it's like, now you're not going to get anywhere. So that was kind of one of the biggest, I think, myths that I mean, I feel that we hear a lot, and certainly I know in my past, before I had any knowledge whatsoever, that would have been my approach to it, you know, because that's what the world tells you. It's what all the commercials tell you. It's what, you know, we've been traditionally taught. So, so to bust that myth, you know,
Yeah.
what are some of the things that you can say to somebody to say, hey, you know what, here's really where you should start. If this is really your goal, here are some of the places that you could start, you know?
Yeah. Well, what's coming to mind right away, since this is a community of women, is just really understanding that the research that's out there, it's all based on men.
Yeah.
It's, you can't deny, like, you don't have to have any sort of degree or any sort of education to understand that you have a period and you don't feel the same on day 1, day 5, day 10, day 20. And there's a reason for that. And the reason is because your body changes week to week and day to day. We know that. There are certain times of the month where you're more prone to stress. And there are certain times of the month where your metabolism is on fire, your energy is on fire, your hormones are peaked. And so I love telling women, first asking them, like, are you tracking your cycle? Do you know where you're at in your cycle? Do you know, like, are you tracking your symptoms? Are you noticing these shifts that naturally happen? Now, of course, if you're a woman, again, dealing with symptoms, maybe you're having irregular bleeding, maybe you're having PMS, maybe you're having thyroid issues, gut issues, they all kind of go hand in hand. But like, if you're experiencing that, it might be a little bit harder to kind of understand and decode your cycle, but it's like just listening to your body, listening to what she says, tuning in, understanding that she changes, and like know the difference between being lazy and needing a rest day, and like just really learning to tune in with your body. I really love telling women, you know, walking is more effective than we give it credit for. I do really love to tell them that like interval training, HIIT is super popular, and with good reason. There's a lot of health benefits, but you don't want to do HIIT on your period. You don't want to do HIIT leading up to it when your body is using all of these nutrients to do this really intensive, energy intensive process. There's a time and there's a place for that, and really just listening to your body. Strength training is another big one. A lot of women feel like in order to strength train, I need to be in the gym and slinging around weights. That's not true. Anything that's applying resistance to your muscles, even if it's body weight, even if you're doing body weight squats, you really want to challenge your muscles, because the older we get and the more our estrogen naturally depletes and our hormones naturally deplete, the more susceptible we become to osteoporosis and losing our bone density. So the more muscles that you can have, the more pro-metabolic you can become, and the better your bone health, the better your hormone health, and the better your cognitive health, all of the things. There's so many benefits. But I did mention earlier too, like that 30-minute mark, like you do not need to work out more than 30 minutes. Honestly, it doesn't matter how in shape you are. It doesn't matter how healthy you are. When you hit around 30 minutes, now I'm sure it's not right to the exact T, but about 30 minutes is your body says, okay, this is no longer that eustress. Now I'm going to secrete cortisol. Now I'm going to start freaking out. Guess what happens? Your blood sugar drops. And if you're not eating something, your body just goes into fight or flight mode. And so a little trick is work out for like 30 minutes, 20 minutes, and then do a cool down, and then get yourself a snack right afterwards to replenish your glycogen stores, meaning eat some freaking carbs and don't be afraid of carbs.
Yeah.
Those are some tips for sure to really help, hopefully. I mean, I know a lot of women are in different places. Some of them aren't able to work out at all. So some of us are just so depleted, and that was a big part of my story. It's a big part of a lot of women's story, where it's hard to get yourself off the couch some days. And my advice to that woman and to my prior self was just do what you can. Try to move your body, even if it's like you're doing laundry and you're moving around the house. Turn your smartwatch on and make yourself feel better about yourself that you're moving your body. Pay attention to your steps, but get outside. If you could get outside and just, even if it's raining, throw a coat on, get some natural sunlight. That'll really help to regulate your circadian rhythm, which will help give you some more natural energy, and allow you to just do very low intensity. Like, honor where you're at in your journey right now. Get the help and support that you need. But even just going for a walk is better than nothing. And I promise you'll probably feel better after like a 15 or 20-minute walk.
Okay.
Yeah.
Oh yeah.
So true.
Well, I love what you said earlier, because I don't think a lot of women recognize the fact that all the research that's been done on really anything. We're talking like diets, we're talking fasting, we're talking exercise, these things.
Medications.
Medications.
Everything's men.
Everything is men. Birth, yeah. And and men have they operate in a 24-hour cycle. That the stress that a man can hold is much higher, because they can do the work, go, and then they can pass out. And like, it's one of the things that's so irritating about my husband, because I'm like, how do you just like go all day and you still sleep like a baby? I'm like, I hate you. But but yeah, and the fact that so many women are on birth control, which is suppressing our natural cycles, and that being like a solution, like, oh, we can just get rid of that period for you. Like, we'll just get rid of it, and then that'll solve all your problems. Mm-hmm. Instead, this idea of actually working with our bodies and getting back in tune with our bodies. Mm-hmm. And I know there's some Facebook groups that I'm in, and a lot of women right now are very curious about, and we touched on it a little bit, but working out with your cycle. Mm-hmm. And they're like, what is this? I'm just hearing about this. Like, does it really work? Because it goes against our nature to be like, oh, I shouldn't do hard exercise for like 8 or 9 days. Like, what is that going to do to my progress? How is that going to affect like the muscle or the, whatever my goals are. So I'm wondering if you can speak to that point just a little bit. Like, how does working out with your cycles like actually help you achieve your long-term goals more than like hinder them?
Yeah, absolutely. And I love that question, because cycle syncing is, while it's not very new, it's just becoming more popular, and women are, mm-hmm. I'm loving that women are waking up to it now, and it's being talked about more. But as far as like how it actually works and will you make progress, the simple answer is yes. You're going to make more progress if you're working with your body instead of working against your body. Mm-hmm. Meaning, I'm just going to like use my fingers here to like kind of like so day 1 of your cycle, let's just say you have a perfect period, and it's a 28-day flow. You ovulate on day 14 and everything is gung-ho perfect. Now that doesn't usually happen even when you do have a healthy cycle. It's not always that like textbook perfect. But day 1 is the day that you start bleeding, and everything, if this is our graph right here, right? Imagine the graph. You're down here at the lowest of low. Your hormones are low, your estrogen, progesterone, testosterone, everything is low. You are depleted because you are shedding your lining. It's super energy intensive. It's like your natural detox process. Honor the fact that your body is using a lot of nutrients right now. And, by pushing yourself during that time, when you're already at a low, when you're more susceptible to stress and you don't even feel like working out, but you're going to use your willpower and motivation to do so anyways, that is really working against your body. You don't have like the metabolic reserve. Your body is using everything it needs right now to just function and do what it's supposed to do. So by pushing yourself over the edge and by working out, the best way to think about it is it's just more stress on your body, which is super depleting. So now going back to our graph, like basically up until ovulation, we kind of just have like this nice upward flow, upwards of estrogen. Progesterone's not really in the picture yet, but your testosterone is going up. So your energy is going up, your metabolism is going up, everything. You're starting to feel like J-Lo's coming out of the closet. Like we can feel like ourselves again. And then when we get to day 14, when we are ovulating, we're peaked. This is when like you're feeling awesome. So between day 1 and day 14, you're going to naturally, when you're in tune with your body, you're going to naturally be like, ooh, I have more energy today. I could do one more task today, or I could do another rep today. Or you know what? I don't know why, but I feel like I want to run a mile today. Girlfriend, do it. Yeah. Because that's when everything is on the up and up. And you can't really go wrong. This is like your follicular phase into your ovulatory phase. You can't really go wrong then to push yourself, because your body is just, it's kind of like spring into summer. Everything is coming out to bloom. And your body is primed for that metabolically, hormonally. You'll also notice during that time you're not as hungry. That's normal too, because your metabolism is kind of like picking up where it left off, and it's gonna like it's a cycle. Like it revs up really high and then it comes to a close. So I'm kind of rambling here. I'm trying to like give good examples. I'm such a visual learner.
Yeah.
But basically, you want to work with the flows, because then after day 14, after you ovulate, which is super energy intensive, it's 24-hour period where you're going to feel awesome for like 3 or 4 days out of the month. And then you're going to slowly, like I said at the beginning of this training, hey, I ovulated last week. I'm going into my luteal phase. I'm going to start noticing I'm a little bit more tired. No, I don't feel like going to the gym, but I'm going to because I know my body is primed to. I'm just not going to push myself as hard, because during this phase, this is where progesterone is popping, and you really want to honor your progesterone. You're more susceptible to stress after you ovulate. So if you go way too hard in the gym, you have the risk of kind of like affecting your ability to keep your progesterone optimized, basically. And so if you did conceive, if you're trying to conceive, even if you're not, it doesn't matter. Your body always, as a woman, is thinking about conception and having a baby. And it's always, am I safe right now? Am I safe right now? Am I safe right now? And the best way to do that is work with the hormonal fluctuations. So when you're coming down from your ovulatory high, you just want to start slowing things down again, doing some more walking, doing some more low intensity, the closer that you get to your period. And then we bring it back to square one. So it's like a cycle. And by doing that, less stress, you're giving your body what it needs. And so in return, the more that you do it, it seems counterintuitive to slow down. But when women start doing this and implementing this, they notice 2, 3, 4 cycles goes by and they have way more energy. They're coming out of their period on top of the world, instead of it taking them 10 days to feel better. It takes them just a few days to kind of feel like themselves again.
Right. And I think it's important to, like, we're talking, we talk about stress I mean, like, stress is our big underlying cause of pretty much any education that we do. And I think it's important to, like, like you said, even if you're not trying to get pregnant, what stress does to your body, like if you're feeding it during that time period, leads to chronic disease. I mean, it just does. It leads to long-term like destruction of, our cognitive function, our sleep, our, depression, anxiety, those types of things. So it's not just, it isn't just about like fertility. It really is like, we need to not feed that stress response as women. And it is really so important to us. And that being said, on the flip side, we've talked a lot about depletion too. And it's like, as women who are postpartum, we are extremely depleted. Like, and we've talked about it, was like, that's normal. Like, you come out of pregnancy and birth, like, not everyone's depleted. Like, you didn't do anything wrong, but you are. And it takes everything out of you. And then let's say in 40 days, like, 40 days is not enough time, in my opinion, to like get everything back together. Most women don't get a cycle for months. There's a lot going on. There's a lot of repair that needs to happen, and rest is like your number 1, 2, 3, 4, 5 priority. And when we jump right back into exercise, or I should say rigorous exercise, because there's a lot of like good healthy movement that you can do postpartum, but like rigorous exercise plans, we are adding stress and then compounding like this depression, anxiety, like bad skin, hair loss, like all these things, challenges that can happen, up to years after you have a baby. So, this cortisol is awesome.
Yeah. Well, the thing is like every single cell inside of your body has a cortisol receptor, and like cortisol being your main stress hormone, as you're speaking into, like, pregnancy is a beautiful trauma on your body. And so I think a huge takeaway from everything that we just said in the past couple of minutes is like, we have to stop fighting our bodies and we have to accept where we're at, And I think that social media has painted a really unrealistic picture for so many of us. And we hear that all the time. I know it's cliche, but it's so true. And like consciously, we're like, I know, Megan, like I'm not comparing myself. I'm not, blah, blah, blah. But subconsciously, you probably are, because comparison is so natural for women. We can't help it. We are empathetic beings. And to be able to love yourself where you're at and like honor the season that you're in, you know, being postpartum, seeing that as a trauma and seeing that as stress, or wherever you're at. Like for me, I wasn't postpartum, but I was like on my lowest of low. Like my practitioner said, I would rather you lay on the couch for 3 months while you heal than physically move your body because you are so depleted right now. And so we could give a lot of general recommendations here. However, I just always think, and I don't say this because I'm a practitioner, I don't say this because I work with clients one-on-one, I say this because I love women, but you should really, really work with someone who can meet you where you're at, who will listen to you, who will take into consideration your whole health history and how stressed are you? How much inflammation is going on in your body? Because when it comes to that stuff, exercise is kind of like, I always say habit stacking is kind of like how I work. Like exercise comes later. Like I want you to, we need to make your body feel safe first. And in order to do that, we need to focus on replenishing what you're depleted in. And when you're postpartum, you are depleted. Did you know that like just being pregnant puts you at risk to destroy your gut bacteria? And like your gut bacteria is everything. It's your immune system. It's how you hormones. It's all of this stuff. So it's working with someone who can recognize that stuff and say, you know what, I would rather just take these 2 to 3 months to start giving your body more of what it needs. So on the cellular level, you can function, and then you can start working out and get your post-mom bod or whatever you want to do. But it has to come later. Like there has to be an order. Otherwise, you're just going to keep spinning your wheels, wasting time, wasting money.
Right.
I'm just gonna as we're talking about this, like exercising and listening and being in tune to your body and what that cycle feels like as being on the other end of that spectrum. You can do that as well. I mean, you certainly, we still have cycles, and I know, people say we can line up with the lunar cycle, but we still have a cycle. As a woman, we have a cycle forever, whether or not we are preparing, our bodies preparing to possibly conceive or not, we still have that cycle, and we still need to be in tune with that. And I still have days where it's like, I swear, Kate will look at me and go, God, Mom, do you know anything? And it's like, well, sorry, my brain's just not operating right now. And these couple of days, give me a minute.
I do say that. I'm like, I don't even know. I'll call and I'll be like, I don't even know what you're talking about anymore.
So it's like, it's no matter what, as a woman, it's the way we're built. It's how we created. It's how, and this is what we have to deal with from the beginning to the end. So just knowing that, if you're past that, if you're perimenopausal or postmenopausal or in the middle of menopause, you still have a cycle that you can get in touch with, get in tune with, and honor, so that you can be the best you can be.
I love that you said that. I think when you start in tune with yourself, honor where you're at, then it can become a little bit more fun, because then when you shouldn't be doing something and you feel obligated to do something, you'd be like, wait, no, let me just lay on the couch right now.
Yeah. You want me to come to that party? Let me check my calendar.
Oh, I'm due.
That's true.
A couple days. I can't be out in public right now.
Yeah. Well, thank you so much for coming on and doing this with us. This was fun. I love talking about this, and it's fun to hear from another practitioner, your perspective and thoughts on everything. So
yeah, totally. Thanks for having me. And if any of your audience, I'm sure that you guys have tons of resources. I do have like a guide to cycle syncing. If anyone wants that, they're more than welcome to message me. It's kind of like the core 4 steps, I call it, to getting in tune with your cycle, and it kind of outlines like all the cheat sheets. So that's super fun and helpful. So if anyone wants that, you can send me.
Yeah, maybe. I can also if I can grab the link from you when I post it on the feed, post this on the feed, I can put a link to that.
Or would you
in
rather
the
have people just
description.
DM you, or how do you want
Do you
people to
want-
get
yeah.
it?
Probably just a DM. I don't have a landing
Okay.
set up. It's a newer.
No, that's so good.
No, that's awesome.
Yeah, yeah. Well, I will make sure I put that in the comments just so people know where to go to get that.
Oh,
So
Megan.
yeah.
Oh, hi, Megan. I didn't pop on. Oh, this was really fun, and we could
Perfect.
chat all day about this.
I know. So true.
Awesome.
All right.
Well,
thank you.
I hope, yeah, have a great weekend, and we'll hopefully talk soon.
Yeah. So nice to see you guys, and
You
we'll
too.
do that. Bye.
Bye.
Bye.